Is stage 4 cancer curable? Stage 4 is the most severe stage of cancer with the highest risk of mortality. However, many factors affect a person's life expectancy, including the type of cancer. For prostate cancer, for instance, the 5-year life expectancy is 32%, but for pancreatic cancer it is 3%. In this video, we describe what stage 4 cancer is and the survival rates for people with different types of cancer at this stage. Is stage 4 cancer always terminal? Stage 4 cancer is not always terminal. It is usually advanced and requires more aggressive treatment. Terminal cancer refers to cancer that is not curable and eventually results in death. Some may refer to it as end-stage cancer. If a doctor determines that cancer is terminal, this usually means that the cancer is so advanced that treatment options focus on controlling rather than curing the cancer. More severe cancers are more likely to be terminal. Survival rates convey the likelihood of living for a certain period, such as 5 years, after a doctor diagnoses cancer. The 5-year survival rate for people with breast cancer that has spread to distant areas of the body is 28%, meaning that 28% of people survive for this period. The same figure for people with prostate cancer that has spread to distant areas is 32%, the American Cancer Society reports. Survival rates can vary based on the type of cancer. The 5-year survival rate for mesothelioma that has spread to distant areas is 7%. For distant pancreatic cancer, this rate is 3%. It is worth nothing, however, that these rates are based on large quantities of data obtained in the past. They may not reflect recent advances in treatment and care. Also, a wide range of factors influence each person's life expectancy. Determining the severity of cancer and its stage is a complex process. Doctors are still learning about all the factors that affect how cancer develops and affects the body. Predicting life expectancy is very difficult. The doctor will consider many variables such as the type of cancer, its location, and whether the person has any other underlying health conditions. How long can someone live with stage 4 cancer? Doctors usually describe a person's outlook using the 5-year survival rate. These are calculated based on data from thousands of other people with a similar cancer at a similar stage. The original location of the cancer determines its type. Survival rates vary depending on the types of cancer and how far it has spread within the body. We'll describing the survival rates for some of the most common forms of cancer in stage 4. Breast cancer is one of the most common forms of cancer in the United States. In 2018, there were 254,744 new cases of breast cancer among females in the country. The American Cancer Society estimates that the 5-year survival rate for people with breast cancer that has spread to distant areas of the body is 28%. Lung. There are two main types of lung cancer, small cell and non-small cell. Most cases are non-small cell. According to the American Cancer Society, the average 5-year survival rate for people with non-small cell lung cancer that has spread to distant areas is 6%. For distant small cell lung cancer, the 5-year survival rate is 3%. However, it is important to note that these figures do not reflect recent advances in treatment. Colorectal. Colorectal cancer affects the colon or rectal areas that is generally treatable in its early stages. Around 1,49,500 new cases of colorectal cancer were diagnosed in the US in 2021. The American Cancer Society reports that the 5-year survival rate for colorectal cancer that has spread to distant areas is 14 to 16%. Prostate cancer is the most common form of cancer among men in the United States. The prostate is a small gland in the pelvis. If the cancer spreads to distant areas, 5-year survival rate is 30%. Stage 4 cancer treatments. The treatment plan for stage 4 cancer depends on the type and how far it has spread. Some treatments aim to improve the person's quality of life and control their symptoms. Others aim to stop the cancer's growth. Treatments that at this stage might include chemotherapy, though the risk may be too high when the cancer has spread extensively. Radiation therapy, which can shrink tumors and help with symptoms. Immunotherapy, which helps the body's immune system fight the cancer. Surgery to remove tumors. Targeted therapy, which aims to slow tumor growth. Stage 4 is the most severe stage of cancer. Metastatic cancer is another name for this stage. It conveys that the cancer has metastasized, spread to distant areas of the body. Cancer is a group of diseases that cause rapid cell growth. Cancerous cells grow and reproduce uncontrollably in a certain area of the body, forming a tumor. As a tumor grows, the cancerous cells can spread to other areas of the body. Doctors typically use a staging system to determine how severe a case of cancer is. This helps them determine the best course of treatment. Range of tests can help determine the stage of cancer. They include physical exams, medical imaging such as MRI scans, endoscopy, biopsy, blood test. Doctors take other factors into account too, which including the size of the primary tumor, its location, whether cancerous cells have entered the lymph nodes, how far these cells have spread within the body, the type of cancerous cells, the person's overall health. Together, this information helps determine whether cancer is less advanced at stage 1, very advanced at stage 4, or somewhere in between.